We finished explaining HIV drugs, so let's move now to HCV drugs, and we will be quicker, since we have already explained the main bulk. HCV, which is the human hepatitis C virus, is a real issue worldwide. Here in Egypt, in America, in India, or in China, all of the world suffer from the HCV. But before we start explaining the drugs, I want to tell you some information that you may need for the MCQ exams, and even for the oral exams, as this information is very important. The first piece of information is that the HCV virus has no vaccine. I write it in Arabic, has no vaccine. There is no immunization nor vaccination for it. There is no syringes I take to prevent its infection. Why? Don't we already have many vaccinations for other viruses? It's because when scientists analyzed this virus, they discovered that it's not a single strain, but there is about 6 strains. Some books say 7. So, there are 7 genotypes. We have different types, from 1, 2, 3, 4, 5, 6, 7, but that's not the problem since we can design a vaccine for 6 or 7 different genotypes and even more. But with further research, they discovered that each type of these 6 genotypes has many different subtypes, so that we don't know its limits. Right now scientists say there are about 80 types circulating the world. Thus how can you make a vaccine for 80 different types? Vaccine can cover as many as 2 or 3 types of viruses, but I can't design a vaccine that covers 80 different types. Then here is your answer. If the examiner asks you, why don't we have vaccines or syringes to protect us from the HCV? Tell him because in the HCV we have more than 6 genotypes, and each genotype of these divides into other different subtypes. That could reach about 80 different types or 80 strains, different from one another. That's why we don't have a vaccine. Instead, we have many drugs, since a drug can cover all of the 80 strains. And this is not possible for the vaccine. Drugs are always somehow bullies. They could swing at the 80 types. They could target an enzyme present in the 80 types. However, vaccines cannot do this. Since vaccines are highly specific, they target a specific part of the virus. Thus, you can't have a vaccine for 80 different types. Okay, now you know we have 6 major genotypes. The treatment of the HCV and drugs that I'll tell you about depend on the type of the genotype. The genotype. So before you start treating your patient, you must run some tests, or a PCR, so you can determine which genotype this patient has specifically, because each one of these 6 has a certain treatment protocol and for a certain duration. But in short, and to avoid any confusion, genotype 1 is more prevalent in the US, genotype number 1. Genotype 4, I told you we have 6 or 7. 1 is in the US, the 4th type is present in the Middle East. Here in Egypt and other Middle Eastern countries, by the way, we also have the genotype number 1. Here in the Middle East, we have genotype number 1, number 4. And unfortunately enough, these 2 types are the worst among the types of the HCV. They are the most dangerous. Their treatment requires double the duration and double the number of drugs and the double dose. Their response is extremely low. On the other hand, the 2nd, 3rd, 5th and 6th types can be treated in just 6 months, ensuring a success rate more than 95%. Scientists were able to design some drugs for this virus, a large armory of drugs, so that they can achieve a cure rate about 95%. Naturally, if you are using them according to the right protocol for the right duration, take into consideration the genotype, okay, you will achieve a cure rate of 95%. And this is such a good omen that we tell to our people who suffer from the HCV. We reassure them that these drugs can achieve 95% cure rate, provided that you diagnose the disease early, because the more the delay, the more the liver gets damaged. Thus the benefit of the treatment is decreased with time. What is there left to treat? The liver is already gone. Moreover, it can change into something called HCC, a type of cancer. So, the more you discover the disease early and treat it early, the more the cure rate becomes higher, reaching 95% or even more. The duration of the treatment ranges from 24 weeks to 48 weeks. If you don't like using weeks, then you can say from 6 months to 1 year. It's very simple. When is it 6 months? For the simple types, which are genotype number 2, 3, 5, these are simple types you can treat in just 6 months. The virus goes, he's completely cured. That's it. Thanks, the patient is completely cured. The villainous types, such as genotype 1 and 4, require double the duration, 48 weeks, or you can say 1 whole year of therapy, because the response rate or the response of these types to drugs is poor, unlike the other types. But how can I determine the cure rate or the effectiveness of the drugs? How could it be judged? When can I say the patient's cured? What is the end point to determine this? It is a term that I want you to remember forever and use it to look good in the eyes of the examiner. This term is Sustained Virological Response. The abbreviation is SVR. Sustained Virological Response means that after you have stopped the treatment and for a duration of 6 months, you run a PCR test for the patient and you can no longer see the virus. The test result is negative. If for 6 months duration, whenever you run a PCR test, we order it each month after we complete the duration of the treatment. Each month we run a PCR test. If for 6 months duration the result's negative, we shake hands with the patient, telling him congrats, you have been completely cured from the HCV. You no longer suffer from the virus C nor its problems. If the virus still appears in the PCR tests, it means we have to repeat the course second and third time, and this means the patient has a poor response and the prognosis is not that good. I don't have hope for the outcome of such cases. The last piece of information that I want to tell you is about this interferon, which will be discussed in detail before the end of this video. This interferon was a very famous drug and we used to use it until recently for the treatment of the HCV. However, today we no longer use syringes of interferon at all for the treatment of the HCV. It has been replaced with the drugs that I'll tell you about in the following slide. That's it for now. It's no longer recommended. We no longer use interferon. As we did with the HIV when we summarized all of the drugs on one page, we will do the same for the HCV. Here we have this drawing and this slide with all the drugs for the HCV plus their mechanisms. You don't need any other source, just print this page, hang it in front of you and give it a quick look each day. Let's see the first step. Do we have drugs to prevent this attachment? No, we don't have any drugs for this step. Do we have a drug to prevent the incoating, which is the second step? No, we don't have any. All what I can do with the HCV is to interfere with this step for replication, the copying step. Then I can also inhibit the protease enzyme, which is responsible for the post-translational processing, as we said before dozens of times. These are the only two steps available, the replication and the processing. We have nothing else. Let's start with the replication. During the process of HCV replication, just don't forget that HCV is an RNA virus. This is a basic knowledge. HCV is an RNA virus, and as any RNA virus, when it replicates itself, it requires about 4 different types of the enzymes. Sometimes there are more, sometimes there are about 6 types of enzymes. Scientists differentiated and assigned each one of them to a certain number, and since it's an enzyme, then it is a non-structural protein. And since I told you in the previous video that enzyme means a component that doesn't share in the skeletal structure of the virus, thus any enzyme whatsoever can be considered NS, a non-structural protein. Scientists discovered that in order for the virus to be able to replicate, it needs 2 types of the enzymes that are extremely essential. These are the most 2 valuable enzymes among the 6 it needs. They gave the first enzyme a name which is non-structural 5A. Non-structural, we got it, it means an enzyme. A non-skeletal protein, but an enzyme. But why 5? Because scientists discovered 6 enzymes and gave each one a number. This one took number 5. And why is the letter A? Because we discovered it has a twin. It's identical twin. They exist together and can't function without one another. Exactly like a duel in a team. They only play with each other. A single one cannot suffice. Thus, they named its twin non-structural, also 5, as they are twins. But it took the letter B. These are the twins, non-structural 5A and non-structural 5B. These are the two enzymes, the most valuable two enzymes HCV needs in order to replicate itself or to copy its genetic material. We were able to design drugs to prevent the first enzyme, non-structural protein 5A, and the second protein, which is called non-structural 5B. We were able to design a drug for this one and for this one. And now scientists are encouraging us to use both drugs together in order to inhibit both enzymes simultaneously, to be 100% sure that the virus won't be able to replicate itself, since you inhibited the most important two enzymes in its cycle. The first family that inhibits the non-structural protein 5A, which is very important for the replication, is called non-structural 5A inhibitors. From this family, we have about 10 drugs or more. Something called Daclatasvir and something called Ledipasvir. I get that you're now being a little confused over the names. Just take it easy. With time, we will pick a distinguished section in each name so you'll never forget it. Daclatasvir, which is present under a trade name of Daclinza. If you check the drugstore in your hospital, you would see this Daclinza in large quantities. Its scientific name is Daclatasvir. Ledipasvir. The second family acts on the second non-structural protein, the 5B, which is the polymerase enzyme, a drug called sofosbuvir. The first one to be discovered in this family, then many drugs followed. They all end with the word buvir. Before we leave this part, I want to stop by something that might be helpful. The family that acts on the protein that's called 5A must end with the word asvir. A, then SVIR. The family that acts on the protein that's called 5B ends with the word buvir. This B tells you it is the one acting on the 5B protein. We will establish this rule for all of the following drugs. Any drug in the world that ends with the word asvir, then it means it acts on the protein called non-structural 5A specifically for the HCV. If it ends with buvir, then it is for the non-structural protein type B. And it is best to get them both together to stop the cycle completely. We can leave all of this and try to stop the virus by interfering with its protease enzyme. This important enzyme, or the tailor which was brought in the toolbox of the virus. You can design drugs to inhibit this protease enzyme. We already have a drug called glycaprevir and a drug called simiprevir. You can also note that they end with the word previr. This PR, pre, points you to the word protease. Be aware that we have drugs for the protease of the HIV. They had different names because I told you that the protease enzyme is not the same in all viruses. Thus, whenever you design drugs for a family of proteases or a family of viruses, they must include a certain term according to a certain naming process. So don't mix them together. By this time, my friend, if you're watching me now, make yourself a cup of tea and take a spin or two around the kitchen table. For the following half hour, your only job is to say these three words. Asvir, this is the first word, and buvir, this is the second word, and to say previr. Anyone who talks to you while making these spins, don't answer him. If he say how are you, tell him asvir, buvir, previr. What's going on with you? Say asvir, buvir, previr. Why? Because if you can memorize these three sections, then you have memorized all of the HCV drugs on the face of the earth. Even if they are 50 or 60 drugs, all of them must end with these three sections. If you see asvir, it begins with A, so it is the one acting on the protein 5A. If it begins with B, buvir, then it acts on the B protein. If the section is previr, then it acts on the protease enzyme of the HCV. I have two notes I want to tell you before we finish the HCV. The first note, if you want to ensure 100% that you will treat your patient within 6 months, or a period of time ranging from 6 months to a year, ensuring the success, you can't treat him with a single family. It's better to use more than one drug, to ambush the virus in more than one step. to hunt it here and also wait for it there by using a combination of drugs. However, unfortunately, when this combination takes place or when we add two drugs together, unfortunately, many patients experienced severe bradycardia and some of them suffered a heart block. And this is a question for the postgraduate. In postgraduate exams and also in the USMLE and other exams. This piece of information, they ask you what happens when you give a drug, say, declatasvir, with another one, say, glicapavir. You already know all of the drugs because I told you how to recall them. And since the question is about a combination of two families, expect that the patient will suffer a heart block or severe bradycardia. Thank you. This is the end of the HCV family. I delayed explaining the drugs of HBV for some time. I wanted to delay it for some reasons. Number one, regarding the HBV, its main treatment is a vaccine, unlike the HCV. When I was explaining the HCV, I told you we don't have vaccines for the HCV because there are many strains of it. There are about 80 strains. Thus, I couldn't make a vaccine. However, when it comes to the HBV, the virus type B, it's only one type, or two, or three, or six at most, as some books say. I can make a vaccine for these 6 types. It's not that hard. Thus, the main treatment for the HBV is that you take its vaccine so you don't contract the virus. It doesn't have treatments afterwards. If I contracted it, if the patient contracted the HBV, the treatment becomes useless. Because when it comes to the HBV, remember, it's a DNA virus, okay? And DNA virus means it enters the liver cells and thrusts itself inside the liver cells forever. You can't remove it by any drug. First of all, you should have taken the vaccine. That's why we don't give much attention to the drugs of the HBV. So that the scientists and doctors worldwide say that any patient with the HBV shouldn't be dealt with. Yes, what you heard is right. Don't deal with him. Leave him. Because drugs won't be of much value for him. And it was found that sometimes patients with the HBV who receive drugs for the virus, their disease gets worse and their condition deteriorates. Thus a worldwide agreement was established that a patient with the HBV shouldn't be dealt with. Except in these following situations. And these situations are not a point of question for the undergraduates, only for master or PhD exams. Listen, my friend, when should you treat a patient with HBV by drugs? You would tell me? Only if the patient condition has deteriorated markedly. Liver enzymes were markedly deteriorated. When you run a PCR test and you find that the viral load has exceeded 2,000 international units or more than 20,000. This means that the virus has taken over him. Or if the patient developed acute liver failure or decompensated cirrhosis, which means that the cirrhosis has progressed too much. Or if he developed liver cancer. As if I was trying to convey that we don't use drugs with the HBV patients unless their condition deteriorates and becomes very late. Otherwise, we don't deal with them. It's considered a chronic disease and we don't interfere with it at all. But what is our options? We have some drugs that we have heard about before. I mentioned them when we were explaining the HIV, a drug called lamivudine. When I told you then, consider it a girl named Lamia. And a drug called tenofovir, which was considered to be a girl called Tina. The new one is a drug called entecavir. The first 2 drugs, which are lamivudine and tenofovir, are considered reverse transcriptase inhibitors. And we used them for the HIV. In the first place, they were only for the HIV. However, and by chance, it was discovered that in addition to their use in the HIV, they can also inhibit the DNA polymerase enzyme of the HBV, preventing the virus from replicating itself in the HBV. This entecavir is specific for the HBV. It's not used anywhere else. So these are the drugs preventing the replication. These 3 drugs, they are the same like one another. There is an old drug which is found in some books from 30 or 40 years ago and it's not commonly used nowadays. It's called ribavirin and interferon. I told you before we will save it for the last. Now I want to tell you a quick word about the ribavirin and about the interferon so we can finish the antiviral drugs. We will start with the ribavirin. This old drug, which has been around for 30, 40 or 50 years, I don't know for sure, this ribavirin is such an old drug. It's a nucleoside analog. This term is no longer new for you and you know what it means. This drug inhibits the RNA polymerase enzyme in a wide variety of viruses. It's not specific for a single virus. It swings at many types, and this drug is non-specific. It can go and inhibit the RNA polymerase in the virus that's called the respiratory syncytial virus, which affect the children and causes inflammations throughout the upper respiratory tract. It can act on the influenza virus. It can also act on the HCV, HBV, despite being a DNA virus. This drug can also inhibit the DNA polymerase of this virus. That's why this drug is considered to be non-specific. It is an old drug and it's not even a distinguished one. It doesn't target a specific virus, and since it's not a specific drug, then we no longer use this drug often. Not anymore. I'm just telling you about it in case you hear about it from your lecturer or in an old book or a previous exam. Anyway, I'm giving you an idea about it. Its adverse effects, which characterize this drug. Ribavirin is a well-known drug to cause hemolytic anemia. This might come in exams, but the more important and the more well-known fact about it is being genotoxic. Genotoxic means it causes malformations in the ovum production in women, in the ovary, and in men it causes malformation in the sperms, so that they say if any patient in the world receives this ribavirin, it's prohibited to think about conception. He should forget about having kids for a period no less than 6 months, because the drug is surely deforming the sperms and also deforming the ovum. This effect can be called genotoxicity or teratotoxicity, as you like, teratogenicity or whatever, just know that it might come in exams. This is the story of the ribavirin. The last thing we have on this video is the interferon, and I intend to give you an idea about it because it is a well-known drug and a common question in exams, although clinically it's not used that much. Its uses are very limited nowadays, but I'll give you a brief talk about it. The interferon. First of all, interferons are cytokines or glycoproteins that are very natural in all of our bodies. This family of interferons were firstly discovered in 1957 by an Australian scientist. Some may say it's an Australian scientist from an English origin, but it doesn't matter for us. What matters is that in the 50s, this man discovered something very odd. He discovered that any cell in our body, when it gets infected by a virus, any cell, it sends a distress signal to a very distinctive type of immune cells, a killer type of immune cells called natural killer. God created a cell in our body named natural killer, a professional hitman, like an experienced sniper with so many trophies. This is our sniper, a professional sniper with so many trophies. This cell has the ability to eliminate anything in our body, either it's a cancer cell or a virally infected one, whatever. So once any one of our cells contracts a viral infection, it secretes a group of glycoproteins or of cytokines, which are these interferons. The function of this interferon is to go and stimulate the natural killer, telling it, save me. I'm in a misfortune. My cell has a virus, and if I remain so, the virus will copy itself millions of copies and the human will die. Save us. So the natural killer cell becomes activated and go to eliminate the virally infected cell. This is a function of the interferon. It's considered a signaling protein, or call it a rescue protein or a distress signal, that is released from the virally infected cells, sometimes, or from the immune cells sometimes. Even tumor cells, cancerous cells themselves secrete it sometimes, in order to stimulate the natural killer cell so it can eliminate the threat. Burning the house on its residents, on the virus. With time, we discovered that the family of interferons are not a single element. With time, discoveries followed so that we discovered 3 types of interferons. Interferon type A, interferon type B, and interferon type gamma. Alpha, beta, and gamma. Each one of these 3 has a function. However, The most potent one among them to stimulate the natural killer, especially during the viral infection. If I contracted any type of viruses, my immune system released the most potent one, which is this interferon alpha. This one, it's the most potent antiviral. This is the one secreted from virally infected cells. So this interferon alpha has the major antiviral effect. Scientists took advantage of this issue. They said very well, since this interferon is a natural substance in our body and it stimulates the natural killer cell to destroy the virally infected cells, then let's make syringes out of it and inject it to the patient subcutaneously. We can synthesize it using the methods of genetic engineering and inject it to the patient. Indeed, they made it and gave it to the patients. However, there was a problem. When you inject the interferon subcutaneously, the main problem is that it doesn't last for hours in your body before it's metabolized. Its half-life is very short. Then what? If someone has a virus, should I wait nearby and from time to time give him a syringe of interferon? Until the scientists and the biochemists had a brilliant trick that was very helpful. They found a synthetic compound called polyethylene glycol. This is a synthetic material that's widely used in many industries like plastics and so on. It's called polyethylene glycol or PEG. They discovered that when you attach the molecule of interferon to this synthetic material called polyethylene glycol, this interferon can last in your body for a week without being metabolized. And this is how they were able to solve the problem of short half-life. And interferon syringes in markets all over the world has become of this type, which we call pig interferon. Don't pronounce it with an I or write it like this. People would laugh on us. Pig. It means it comes from pigs. Not at all. It is written with E because it doesn't come from pigs, nor it has anything to do with them. PEG is short for polyethylene glycol, or you call it pegylated, and so on. This is the interferon that we give subcutaneously for the patients with the HBV, not the HCV. We don't use the interferon for the HCV anymore. However, for those patients who suffer very badly from the HBV, as we agreed before, we can give them a syringe of interferon once every week subcutaneously, hoping to stimulate the natural killer cell so it may eliminate the virus. The last slide or the last photo we have is this one. This is the last one about the interferon. I'll tell you about the mechanism, the uses, and the adverse effects. Let's start with the mechanism. When was it discovered? I told you in 1957. And it was discovered by that Australian man, and until this moment, we don't know the exact mechanism of the interferon. We studied the interferon for 60 or 70 years, and all what we could have is that it interferes with the viral replication. It stops the virus from copying itself, the process of replication. It stops it. But how? We don't know. What is the name of the enzyme that's inhibited by the interferon? God only knows. We have no idea. It is general, something universal for many of the viruses. From here came the name. It was called interferon because it interferes with the viral replication. Put a full stop. No one will ever ask you how. It's what it is. Other people adopt the idea I told you about, that it stimulates the natural killer cell in order to eliminate the cell infected by the virus, as if it was responsible for initiation of the process called apoptosis, or the suicide of the infected cells to prevent the infection from spreading. Other people suggest that it regulates the immune response, it organizes the immune system and the teamwork. That's okay, no problem. All of these are theoretical mechanisms suggestive for the action of the interferon. Now the therapeutic uses. The most commonly used type of the interferon is the alpha. This alpha interferon is the most common used type for the patients with the HBV. As we agreed before, not for all patients, only for those with advanced stages of the disease, the group that we mentioned before. Today we no longer use the interferon for the HCV. HCV has now plenty of recent drugs that we have explained. So this is the most common use of it. And it's now replaced. because it caused some adverse effects which will be discussed now. The second use of the interferon in some types of cancers, two types of cancers, very distinctive types. One is called hairy cell leukemia, a type of blood cancer called hairy cell leukemia. And the other type, which is not written here, a type of melanoma, which is a skin cancer, melanoma. In these two types, we use the interferon type alpha. It has some good results in these two types. The third use is in multiple sclerosis, which is a rare but potentially disabling disease of the CNS. Regarding this multiple sclerosis, its pathogenesis is not well understood, and it has a complex story. However, it was discovered that patients with multiple sclerosis who receive interferon has better prognosis. Their relapse rate is less frequent and the patient can remain for longer periods without relapsing. But not all types of the interferon, only interferon beta. It is the one used for the multiple sclerosis. And this question will only be asked if the examiner has a beef with you. If there's a bad blood between you and your examiner, then be prepared for this question. Which type of the following interferon or which one of these types is used for treatment of multiple sclerosis? So the answer will be the interferon type beta, not the alpha. Alpha is for the viruses and some types of cancer. However, beta is the one for the multiple sclerosis. Let's conclude with the adverse effects of the interferon and we will memorize them by the word interferon. Interferon is abbreviated like this in any book. Its abbreviation is IFN. It's short for interferon. From these three letters, we will get the adverse effects. The letter I stands for immune disturbance. This I of the interferon is for immune disturbance. Patients on the interferon suffers from an immune disorder called autoimmune thyroiditis, and they are liable for any immune disturbance. F, the second letter in the abbreviation, is fatigue and flu-like symptoms. Fatigue is already known. It means muscle weakness. The patient on interferon becomes very tired. I once saw a patient who told me this a while ago. He told me, doctor, I can no longer eat. I can't masticate the food anymore. I asked him why. He answered, cause I'm on interferon. When I masticate the food, my face hurts. Mastication is painful and I can't continue the meal. This is the word fatigue. And flu-like symptoms? Flu means a cold. Symptoms similar to those of the cold, as if you have a common cold. When you receive a subcutaneous injection of the interferon, on the next day, you suffer from some nasal secretions and teary eyes, or aching body and myalgia, arthralgia, exactly like if you are having a common cold. Thus, it's called flu-like symptoms. And of the interferon abbreviation reminds me of neurotoxicity. Neurotoxicity means anything with the nervous system. It could be neuropathy, nerve inflammation, depression, psychiatric disturbances. All of this could happen. And we see them with our own eyes on the patients who receive interferon. How many times we saw patients on the interferon that became aggressive, fighting with even themselves because of some psychiatric disturbances. Now A and B. Didn't we mention that interferon has a type called A and a type called B, which are alpha and beta? So here are the A and the B. This A reminds me of the word anemia, and the B reminds me of the term bone marrow suppression. And these are the adverse effects of the interferon. And now we have finished the antiviral drugs.